Assalamu alaikum. I am Dr. Noushin Rahman, Assistant Professor of Department of Pathology. Today I am going to discuss about granulomatous inflammation. Macrophages are the dominant cells in most chronic inflammation. These are professional phagocytes. These are derived from the hematopoietic stem cells in bone marrow in postnatal life. They are diffusely scattered in connective tissue. In circulatory system, macrophages is known as monocytes. On the other hand, when it is in the tissue, it is known as macrophage or histiocytes. There are special names in different locations of macrophages, like in liver it is known as Kupffer cell, in spleen it is sinus histiocytes, in brain it is known as microglial cells, and in lung it is known as alveolar macrophages. Macrophage activation is done by two processes, one is classical pathway and another one is alternative pathway. In classical pathway, macrophage is activated by microbial products, gamma interferon, foreign substance. Activated macrophage release reactive oxygen species, nitric oxide, lysosomal enzymes which are microbicidial. On the other hand, they release cytokines interleukin 1, 12, 23 which causes inflammation. In another pathway, that is alternative pathway, where macrophage is activated by interleukin 4, interleukin 13, and they produce growth factors, transforming growth factor beta, which helps in tissue repair and fibrosis. On the other hand, they release interleukin 10 and gamma interferon, which causes anti-inflammatory actions. Inflammatory cells try to eliminate or eradicate the infective agents. When the infective agents cannot be eradicated, then they try to contain it. Granulomatous inflammation is a form of chronic inflammation which is characterized by collection of activated macrophages, T lymphocytes, sometimes with central necrosis. Granuloma formation is a cellular attempt to contain an offending agent that is difficult to eradicate. In this attempt, there is often strong activation of T lymphocytes leading to macrophage activation, which can cause injury to normal tissue. Normal macrophages are large cells in a central round nucleus and vacuolated cytoplasm, but epithelioid cells has abundant pink eosinophilic granular cytoplasm with indistinct cell border. The nucleus is elongated, vesicular with nuclear membrane indentation. Aggregates of epithelioid cells, they also form multinucleated giant cells which are surrounded by collar of lymphocytes, fibroblasts and connective tissue. Now, types of granuloma. There are two types of granuloma. One is foreign body granuloma and another one is immune granuloma. Foreign body granuloma incited by foreign body, absence of immune response, talc, sutures and fibers. Examples of disease with granulomatous inflammations are tuberculosis, leprosis, syphilis, cat scratch diseases, sarcoidosis and Crohn's disease. Recognition of granulomatous inflammation is very important. Tuberculosis is the prototype of granulomatous disease caused by infection and should always be excluded as the cause when granulomas are identified. Tubercle. Granuloma in tuberculosis is known as tubercle. Focus of activated macrophage which is rimmed by fibroblast, lymphocyte, histiocytes, occasional Langerhans giant cell, central necrosis with amorphous granular debris and acid fuzz bacilli. Caseous necrosis, in gross it is seen as granular and cheesy appearance, and in microscopic examination it is amorphous structureless eosinophilic granular debris with complete loss of cellular details. Giant cells. There are many kind of giant cells, but in tuberculosis we get the Langerhans type of giant cell which is not Langerhans type of giant cell. Some other giant cells is foreign body giant cell, Teuton giant cells and tumor giant cells. Thank you. That is it for today.